Hello everyone, today's video is about visual snow and tinnitus or ringing in the ears. Just before jumping into the body of the video, if you don't mind taking a quick second to please like, share, subscribe, or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. And also, nothing that I'm saying in the video today should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So someone posted a question on one of my other videos, and the gist of it was, are there any treatment suggestions for visual snow and tinnitus? And that the person heard that they've been associated with chronic Lyme, also known as persistent borreliosis. So I saw the question and heaved a little bit of an internal sigh because tinnitus is just one of the least favorite topics for me to discuss because it's oftentimes hard to treat. And when I've picked the brains of some of my mentors, hearing different at conferences, folks asking questions about this or that from, experts in different fields, questions that'll come up is like, so what about tinnitus? And like what I typically hear, even from the best in the field, is, 50% chance of seeing an improvement or getting it to go away. It just seems to be this really a symptom that is inconsistently helped by the realm of medicine in general. So it's something I'm happy to post a video about, but it's a little less exciting than like chronic sinus issues, mold issues, chronic pain. Like these are the things, like they're not necessarily easy to treat, but it's quite common that we see very satisfactory results, very satisfying results with those conditions. Tinnitus is one of those symptoms where, too many times in my practice career have I had to say let's give it a shot, but I can't make any promises, with any symptoms. But, kind of like, we'll give it my best crack, or I'll take my best crack at it. But even if we're really, really comprehensive, sometimes we just cannot seem to find the answer. And that's just, it grinds my gears because I like folks to get all the way better. But anyways, I'll tell you what I know and we'll go from there. So visual snow, let's start with that. It's a little more optimistic. Visual snow is something that I have seen, I've had a number of patients report. It's not a super common symptom in my experience, where I've treated, hundreds and hundreds and hundreds, and consulted on hundreds of others, cases of complex chronic illnesses. And it's certainly not a, front and center symptom, but I've seen it maybe, I don't know, a little over a dozen cases, maybe 20 cases or so, where that's been like a notable symptom that the patient's been dealing with. Now, getting into like floaters and eye pain and weird eye pressure and stuff, I've seen that in many other patients, but in terms of visual snow specifically, not a super common symptom. The patients that I have seen it in, they've all been dealing with some type of chronic infection, whether it's persistent borreliosis or something else. I'd say the majority, if I had to think about it, were suffering from borreliosis as at least one of the facets of their health issues. And what I've generally found, maybe not surprisingly given that correlation, that systemic antimicrobials seem to be the most effective treatment strategy. So I've discussed in other videos how my favorite herbs to work with are these kind of combination tinctures that include herbs like cryptolepis and Chinese skullcap and Japanese knotweed, cat's claw, alcornia, ceta. Might as well list them all off now since I'm already almost there. Isatis and, oh darn, don't know if I can remember the last one off the top of my head. Can't remember which ones I've already said, but that's my kind of sort of octad, if you will, a combination of 8 herbs that I tend to use most commonly, usually in a tincture form, and I found that those are usually effective at gradually reducing those symptoms. Had a couple of patients where it wasn't until we brought in low-dose immunotherapy that was, might have been for Borrelia. I don't remember, to be honest, off the top of my head, because sometimes it's, Borrelia is what's, comes up on the lab testing. That seems to be what's driving a lot of the symptoms, but then it isn't Borrelia LDI that helps the patient. It's Bartonella LDI, Babesia LDI, or Mycoplasma. So I can't remember offhand if it was Borrelia specifically for LDI, but I have had a couple of cases where that was really notably helpful for the visual snow cases. And generally, in my experience, we can usually clear up the visual snow. Now, don't get me wrong, if there's some underlying eye pathology and that was pre-existing and there was already some visual snow in the first place, and then the person got some chronic infection and that made it worse, we might only be able to get it back to infection levels, but generally the visual snow has not been too challenging to treat in my experience. The tinnitus, on the other hand, so I've certainly seen that associated with Lyme, and quite frankly, folks where it's like my ears were fine, and then I developed symptoms of chronic Lyme aka persistent borreliosis, and a bunch of symptoms came on, including tinnitus, those would be the cases where I have a higher level of confidence that we're going to be able to get a notable improvement or resolution of the tinnitus, because it was something that was induced by a really definitive cause in that case, or definite cause. So in those cases, the odds might be more like 80% plus that we'd see an improvement, or a resolution of symptoms. As the questioner had, as the person putting forward the question had asked or had indicated, yes, persistent borreliosis / chronic Lyme could certainly be a trigger. Could be another type of infection. I've had some patients where when we cleared heavy metals out of their system, that led to an improvement or resolution of their tinnitus. In some cases, it's mold illness. So pretty much all the chronic stuff that we talk about, or that I talk about and others talk about in the complex chronic illness world, those very common triggers are oftentimes triggers for tinnitus in my experience. I think I've had a couple of patients where we got adequate methylation support in place, and that helped or resolve the tinnitus. A couple of patients were high-dose antioxidants. If memory serves, I think it was a full spectrum vitamin E, so like all the mixed tocopherols and tocotrienols, not just alpha tocopherol by itself, along with glutathione, I believe has been helpful in some other cases. So those are kind of either treating the root cause factors like mold, metals, or chronic infections, or working with the right more like orthomolecular dosing of methylation supports or antioxidants, are generally kind of in the just kind of the top of the list of things that I'd be looking at for tinnitus. Now, of course, if a person had a lot of worked in a really noisy environment or listened to music way too loud when they were a teenager or something like that, if there's actual sensorineural hearing loss, then that's something that I don't know if any of those treatments would really make a big difference. I've had some patients where like antioxidants in those cases have seemed to be helpful, but if it's just straight up hearing loss due to nerve damage, then I don't know that there's that much we can really do to help. I mean, maybe getting into the realm of stem cells or peptides, things that unfortunately we don't have access to here in Canada, which are things I'd like to play with, but just can't do it on this side of the border. That maybe there's better answers or more, maybe there'd be more help for folks using those types of therapies, but I don't know. I haven't had any patients who have used those or haven't heard reports on that from colleagues or whatnot who do have access to those therapies. So I think those are all the thoughts I want to share about this topic. If there are any further questions on this topic or questions on anything else, please don't hesitate to post in the comment section below, and I will leave it there for now.